We are heading into the peak of wedding season. With all eyes on the bride, the pressure to look perfect can lead to some far-fetched ideas. Joining us now to talk about the do's and the don'ts of pre-wedding beauty treatments is the plastic and reconstructive surgeon, Dr. Alexis Parcells. Thank you so much for being here with us today. I mean, there's a lot of pressure that goes into the big day.
There sure is. Thanks so much for having me. Yeah, wedding season is certainly upon us right now. And I like to tell my brides and my mothers of the bride, mothers of the groom, just as you're preparing for the wedding, it's important to prioritize your look. You're going to be spending so much time, money, and energy on the experience. And so you want to look and feel great. And it's important to get started early.
That's right, because honestly, makeup can only do so much. Let's start with injectables. We're talking things Botox, maybe even lip filler. It's so mainstream that women in their 20s, it's not just something that older people do. Like, young women are doing this. What are you seeing?
Absolutely. I mean, I have patients coming in their 20s and their 30s, and they prioritize the way that they look, the way that they feel, and small treatments go a long way. I say, especially to my naive patients, let's start small and build upon that. So especially for a new bride or a mother of the bride or groom who's never had a treatment, you do not want to go somewhere and have them do too much to you. My recommendation is to find someone that aligns with what you're looking for, ask to see before and afters, tell them, be candid about what your budget is, and start early so that you can try a Botox treatment, try a filler, see if you like the way that it looks. And that way you can replicate that effect for the big day.
Okay, and what about chemical peels? Is there like a specific window of time for doing this?
It's a great question. So my do not for this is don't do this too close to the procedure. I'm sorry, too close to the wedding. You want the chemical peel, the laser, the microneedling, any of these invasive treatments to be done months in advance. It takes a really long time to see the results from these treatments. And there is downtime. There's bruising and swelling. And so oftentimes they're sold as a package, maybe 2 or 3 treatments. So it's good to get started about a year out, 9 to 12 months. So you, again, can do those treatments 4 to 6 weeks apart and recover in enough time to see that result that you're looking for.
So planning ahead is the key to when it comes to certain procedures, basically.
Absolutely. If you are going to invest in yourself for the big day, like I said, be candid about your budget and be candid about your timeline. That's the best way to set yourself up for success. And I also say you should be wedding ready 3 to 4 weeks before the wedding. That way, you know what you're going to look like. You can have your makeup artist do their magic the morning of, but you're set. You're not going to experience any bruising or swelling at that point.
Okay, and we've talked about the bride. What about cosmetic procedures for the mother of the bride? Do you find that the moms are going for anything in particular, and what should they be aware of?
So it really varies. Again, people have very strong feelings about plastic surgery, but there are some very popular in-office treatments that I perform. One is an earlobe repair. As we age, our earlobes tend to sag and the holes can get a little bit longer. And so that's something that I perform in my office with a little local numbing medicine. It takes about a half hour. Stitches come out in about 2 weeks, and I tell them they can re-pierce their ears about 8 weeks later. And that way, mom feels great wearing whatever earrings she'd like to wear. The second procedure that I also recommend is an upper eyelid lift. Again, I do these in my office under local numbing medicine. You can't drive yourself home, but really no pain involved. Stitches come out in 5 days. We're just taking a little bit of extra skin on that top eyelid, which after 40, we just get extra skin there and it can cause heaviness on our lids. That again will really help open your eyes for the big day and just make it easier to apply makeup and look very youthful. Very natural results with both of these.
That sounds awesome. Do you have any other last question, just overall skincare tips for anyone that's going to be in the wedding party?
Absolutely. Great question. In terms of skincare, if you have some time and you can invest in medical grade skincare, these products are going to penetrate deeper into the skin. They have more clinical efficacy than anything you'd buy over the counter. You can look for clean medical grade skincare options. What I would avoid is trying to change up your routine too close to the wedding. If you're within that, 1 to 2 month window, just stick with what's working. The last thing you want is to have a negative reaction from a new product. So if you have the time and you want to invest and you've got 9 to 12 months to try some new things, that's great. Otherwise, just use what's working and let your makeup artist do their job on the wedding day.
And they can work some magic too. All right, Dr. Alexis Parcells, thanks so much for being here with us today.
Thanks so much. Have a nice day.
All right, Daytime will be right back.